Welcome everyone. In this video we will discuss basic surgical instruments used during Caesarian section. These are surgical scalpel, scissors, needle holders, forceps, tissue clamps, handheld retractors, and towel clip. Surgical scalpel. Scalpel is a sharp knife used for initial incision and cutting tissue. It consists of a blade and a handle. Surgeons often refer to the instrument by its blade number. For Caesarian section, we usually use number 10, 15 or 20. Scissors are used for cutting tissue, suture or for dissection. Based on their function, they can be broadly classified as dissecting or tissue scissors and suture scissors. They can also be classified as heavy or lighter scissors. Heavy scissors like Mayo scissors are available in multiple varieties. Straight Mayo scissors are used for cutting suture and are called suture scissors, while curved scissors are used for cutting heavy tissues like fascia. Lighter scissors, example like Mettenbaum or iris scissors, are used to dissect or define tissue planes. The tripod grip allows maximum shear, torque, and closing force to be applied and provides superior stability and control. Needle driver. Needle drivers are locking clamps that have handles of various lengths and short jaws. Cross-hatched ridges on the jaws allow secure grasping of the needle. This allows the user to maneuver the needle through various tissues. Most needles should be grasped approximately 1/3 from the suture end. It is most efficient to drive the needle using pronation or internal rotation of the wrist. Needle drivers have a variety of handle lengths to accommodate the depth of the surgical field. Forceps, also known as non-locking forceps, grasping forceps or pickups. They are used for grasping tissue or objects. Forceps are held so that one blade functions as an extension of the thumb and the other an extension of the opposing finger, and it can be toothed or serrated or non-toothed at the tip. Toothed or tissue forceps are toothed at the tip and are used when a firm grasp is more important than gentle tissue handling. These tools are often used to hold fascia for abdominal wound closure. Non-toothed forceps, also known as smooth forceps, exert their grip through fine serration on the opposing tips. They are typically used for delicate tissue handling and provide some holding power with minimal injury. Tissue clamps. These clamps are designed to grasp tissue and apply pressure. A variety of clamps are available for many different applications. Almost all tissue clamps feature finger rings with a locking device. Hemostatic clamps are hemostat artery surgical forceps that feature transverse ridges along the distal jaws of the clamps. They are designed to securely occlude blood vessels or vascular tissue and are available in a wide variety of size. They may be straight or curved to fit tissue contours. Example: mosquito forceps, Kelly forceps, pin forceps, and extra. Green Armitage. Green Armitage hemostatic clamps are used to hold the incised uterine edge at Caesarian section prior to closing the hysterectomy incision. Cocker clamps. Heavier clamps are required to grasp and manipulate stiffer tissues such as fascia. Cocker clamps have transverse ridges along the jaws and heavy toothed ends for gripping fascia or tough tissues such as the cut edges of the vagina. The ring forceps. The ring forceps has large open circular jaws with fine transverse grooves. These effectively grasp broad flat surfaces. Additionally, a folded gauze sponge can be placed between its jaws and used to absorb blood from the operative field or gently retract tissues. Handheld retractors. Handheld retractors are versatile and can accommodate most retraction needs. In varying forms, retractors are used to hold an incision open, hold back tissues or other objects to maintain a clear surgical field or reach other structures. There are various types of handheld retractors, but retractors which are most commonly used during Caesarian section are the Army-Navy retractor, which is a thin, shallow right-angled retractor with blades at both ends to provide retraction of the skin and subcutaneous tissue. Richardson retractor has a sturdy, shallow, right-angled blade that can hook around an incision for abdominal wall retraction. Langenbeck retractor are light retractors and used to retract skin during closure of the rectus sheath at Caesarian section. The bladder retractor. The bladder retractor is a specialized instrument which is used to retract the bladder during Caesarian section to gain access to the uterus. Towel clips. Towel clips are mainly used to fasten drapes or towels to patients during medical procedures in order for them to stay on. In summary, on this video we have discussed about basic surgical instruments used during Caesarian section like surgical scalpel, scissors, needle holders, forceps, tissue clamps, handheld retractors and towel clips. Thank you.